Jessica from The Why, and I'm going to talk to you about mental health and emotional well being. Here at The Why, we talk a lot about health. We care about you and your healthy living. A lot of times when we talk about health, though, we're talking about physical health. We're going to encourage you to come into our facilities when they're open, and we're going to encourage you to do things like group exercise classes and fitness and maybe swim to really focus on your physical health. But we also care about your mental health and emotional well being. And mental health is sometimes equally as important, if not more important, than your physical health. And just like with your physical health, your mental health and emotional well being will have its ups and will have its downs. And we recognize that for some people, right now is a really challenging time for their mental health and emotional well being. And so we want to talk about that. So, first, the first kind of tip is try to acknowledge what you're feeling. You may be feeling completely out of control because this time is like no other than we've ever experienced, and you may just not really feel like you're in control of anything. You may feel sad, you may feel anxious, you may feel really stressed, there may be some fear involved. Try first to acknowledge what you're feeling and give it a name. When we're able to name how we're feeling, it gives us some power to be able to move forward. If you can, try to sit in those feelings. I'm not going to tell you it's always easy, but try to sit with whatever you're feeling. Studies have shown that if you're able to just sit with your feelings, you're able to process and move forward with them a little bit quicker than if you try to ignore them and act like they're not there. So acknowledge what you're feeling and just sit in it for a few minutes. Call on your people. We are made and built to be in community with other people. Our brains thrive off community and off being with other people. And just because you're isolated, it doesn't mean that you have to be completely isolated from your people. So if there are people in your house with you, maybe you sit down and have a conversation about how you're feeling. If you don't have people in your house with you, or if you want somebody else, maybe you pick up the phone or hop on FaceTime or Zoom or some sort of app. Get on social media. Talk to people that you care about and who you trust to be able to have these conversations with. And just work with them about what you're feeling and say, I'm feeling really scared right now and I want to be able to talk about it, right? And be able to be that for somebody else. Because we really need right now each other, and we need to be able to talk through how we're feeling if we're able to move past them. For some people, they will need some additional support and resources, and they may need some professional help. Most therapists are still practicing right now. A lot of them are using telehealth, and there are still therapists that are taking new patients. Psychology Today is a really great website to find new therapists. There's lots of ways that you can filter and try to find new therapists who are accepting new patients, therapists who potentially take your insurance if that's an option. And so I've put a link to that below. But if you need professional help, now is a time to be able to reach out to someone and maybe get a therapist, to have someone who can be able to talk to you about these things. But at the end of the day, it's really important to us that you focus on your mental health as well as every other part of your health right now. Thanks. Bye.